On World AIDS Day, the Biden administration renewed its focus on ending the HIV/AIDS pandemic by 2030, releasing a new 5-year strategy for the United States global response. Today, the administration is accelerating its response to HIV/AIDS with new global goals, including reaching key treatment targets across ages, genders, and population groups, supporting targets to reduce new HIV infections, and closing equity gaps for certain groups, including adolescent girls, young women, and children. And starting in 1988, World AIDS Day was the first time ever a health day was observed globally.
This year's theme for World AIDS Day is Equalize. It is a rallying cry to address disparities and do everything we can to end AIDS.
Dr. Ryan Westergaard is an associate professor of medicine at UW-Madison and an expert on infectious disease. Doctor, welcome back to Live at 4.
It's wonderful to be with you. Thanks
nice
for
to see you.
HIV/AIDS for the last couple of years has taken a backseat to COVID, but the problem is still with us.
It's been stubborn. You're right. HIV/AIDS peaked in about the mid-90s in terms of new infections, and it declined rapidly after the introduction of highly effective therapy, which of course we still have. The problem is that many people who have HIV don't know that they have it, and that's actually responsible for new infections every year, about 35,000. So our messages to people are for everyone to get tested and to know how to protect yourself against HIV.
It's been almost 40 years or over 40 years since we first learned about HIV. How has treatment progressed over the past 4 decades? Are we any closer to finding a cure for this or potentially a vaccine for it?
Yes, there's been steady progress. The life-saving treatment of triple therapy or highly active antiretroviral therapy came around in about 1996. And since then, deaths from AIDS have plummeted, not only in the US, but in the world. Since then, they've only gotten better to where most of my patients that I see in clinic take a single pill, a small one with very few side effects, and it keeps the virus in check. So there's been tremendous progress on controlling it, but still not a cure. We are unable to eradicate the virus from someone's body. There's still hope that we can come up with new strategies for that, and there's exciting research just released this week about more progress in vaccine science, where we could have a vaccine that could prevent infection for people who get exposed to the virus. But right now, the state of the art is daily therapy, and when people take it, they can live a long, healthy life.
A lot of those early patients passed away, but since we have the new treatments and the therapies, people are living longer. Are they going to lead regular long lives, or is there going to be complications along the way?
No, I think if I see a patient who's diagnosed shortly after infection and they get started on treatment right away, there isn't really any time for the virus to do damage to the immune system. I feel pretty confident telling that person they'll live a normal lifespan and have a normal life. Some people, if the virus causes an infection for years before it's detected, can do some damage. And then we see increased rates of things like heart disease, cancer, as well as certain infections. So that's really why it's important for people to get tested, particularly people who are at elevated risk because of unprotected sex or if they've had a sexually transmitted infection.
It's pretty remarkable how quickly that treatment came along.
Mm-hmm.
It is. It was a triumph of both medicine and public health to not only develop a treatment, but then to get it into a system that we have in this country to provide person-centered care, including things like case management and referrals to needed services, to make sure that no one gets left behind with this life-saving treatment. There's a lot of things we can learn from how well we've done HIV for other medical and public health problems facing us today, for sure.
It is great to note on World AIDS Day, December 1st. Doctor, thanks for being with us today.
Dr. Westergaard, great to see you. Thank you so much for your time.